Hello and welcome. I'm so glad that many of you are joining us today for my presentation. Thank you so much for being here. My name is Dr. Susan Daniels. I'm the National Autism Coordinator for the U.S. within the Department of Health and Human Services. I also am the Director of the Office of National Autism Coordination, which is within the National Institute of Mental Health, which is part of the National Institutes of Health in the U.S. And I'm really pleased to be able to bring you this presentation to share with you some of the work that I do as National Autism Coordinator and the work we do through the Interagency Autism Coordinating Committee in the United States. So I'm going to start my presentation. So I'm going to be talking with you today about autism and neurodiversity, which is a topic of global and national interest. As many of you know, autism is well known now, and we see a lot of autism and neurodiversity related issues in the news headlines. We also have a number of different issues that affect us all in our daily lives, and they also are topics that are covered in the news media and in government agencies. So this interest has created the need for national autism strategies around the world. And there are many countries that have them. The United States was the first in 2009 to release its national autism strategy called the IACC Strategic Plan. And just recently, Canada released its national autism strategy in September, and in August, Ireland released theirs. New Zealand has had one for about 3 years. They have their third edition of their autism guideline. Malta, Scotland, and there are several other countries that now have national autism strategies, which is really exciting. And we are eagerly awaiting to see Australia's national autism strategy released. So in the US, we have a federal autism coordination system to connect the multiple stakeholders that are involved in autism-related issues. So some of the stakeholders include the White House, Congress, which is our legislative body, federal departments and agencies, state and local agencies, researchers, clinicians, and service providers, and most importantly, autistic individuals, family members, and advocacy organizations. So within the US, we have many different federal departments and agencies that are involved in activities related to autism, neurodiversity, and disabilities. And I've shown some of the different insignias of each of these on this slide. And some of the topics that are covered by these agencies include health, education, labor, justice, housing, social services, emergency preparedness, scientific research, transportation, defense, museums and libraries, diplomacy, human rights, and the arts. And because of this great number of different parts of our federal government that are involved in autism and disability-related research, there's a need for Congress. The Congress recognized the need for there to be a strong system of federal coordination of autism-related efforts. And the Autism Collaboration, Accountability, Research, Education, and Services Act, or the CARES Act of 2019, and previous legislation that dates back to 2006, created a system in which we foster communication and collaboration among federal agencies and non-federal partners. We ensure that there's public input coming into the process from autistic individuals and family members. And we support autism research services and policy that will meet the needs of people on the autism spectrum and their families. And there are two key layers of this coordination, which are the Interagency Autism Coordinating Committee and the National Autism Coordinator. So I'll be telling you about both of those today. So the Interagency Autism Coordinating Committee is a federal advisory committee that coordinates federal agency efforts and provides advice to our Secretary of Health and Human Services on autism. And this committee currently is quite a large committee. It actually started much smaller many years ago, but the membership currently includes 23 different federal agencies and departments and 21 public members that represent diverse life experiences and expertise. And the Autism CARES Act requires that committee members, the committee includes autistic adults, parents and family members, and leaders of advocacy, research, and service organizations. And the management of this committee is overseen by my office, which is the Office of National Autism Coordination within the National Institute of Mental Health within the National Institutes of Health. So the Autism Cares Act in the US is our key legislation that authorizes the IACC and several federal programs related to autism at agencies such as our Centers for Disease Control and Prevention that provide our autism statistics, our prevalence statistics, the Centers for Medicare and Medicaid Services, the Administration for Children and Families, and the Health Resources and Services Administration. So the IACC's current authorization under the Autism Cares Act of 2019 expired in September 2024, but the work is currently being carried forward under a continuing resolution that Congress put in place to keep our government running through December. And Congress is working on the reauthorization to the Autism Cares Act that will hopefully be passed in 2024. The 2019 legislation authorized $1.8 billion in funding for autism research and services activities in the US. And if you want to follow what's happening with this legislation, we have a page about this on our website, the IACC website, and I provided the link here. So the membership of the IACC that just is on the verge of completing their terms, this was the largest and most diverse committee we've had to date, representing many different parts of the United States, many individual perspectives and different types of expertise, as well as many different federal agencies. And it has been a real benefit in our system that we have in the United States to have all of these individuals work together and to have both federal input and public input into the process of creating our strategic plan. So the responsibilities of the IACC under the Autism Cares Act include convening at least twice annually, which actually we usually convene about 3 to 4 times annually, or maybe even 5 times each year. We coordinate federal agency activities related to autism. The committee gathers public input on issues related to autism through a number of means. We always have public comment at our meetings. We also sometimes issue requests for information from the public where people can write in answers to questions that the committee wants to gather information on. We also develop and annually update a strategic plan for autism that will guide federal activities in this space. The committee also is directed to develop an annual summary of research advances that is shared with Congress, but also is available to the public. And in this document, the top 20 advances for the year are selected by the IACC from a large list of nominated articles that they have seen in the literature that represent advances in autism research. The committee is also charged with monitoring federal activities related to autism and to provide advice and recommendations to the HHS, or the Department of Health and Human Services Secretary. So the core values of the IACC include having impact, in other words, focusing on making a difference in the lives of people in the autism community. We also have a community focus, emphasizing the need for inclusion of community stakeholders with lived experience and partnerships with underserved communities to enhance research services and policy. There's also a value of equity and inclusion, wanting to increase equity and reduce disparities across the lifespan, across the spectrum of ability and disability, across sex and gender, racial and cultural boundaries, socioeconomic status, and the geographic location across the country. There's also a value of excellence, wanting to pursue the most innovative and high quality scientific research, responsiveness to the needs of the community, and a spirit of collaboration in which we aim to treat others with respect and listen with open minds to diverse experiences. And as we all know, sometimes in the autism community, there's a lot of passion and a lot of different points of view, and our committee tries to keep everything in the spirit of collaboration, that we all want to share our different views to try to work together to come up with a diverse set of solutions. And within the Office of National Autism Coordination, the IACC, one of our guiding principles is transparency as well as accessibility. And we try to make all of our meetings, they are all open to the public, available on video, as well as all the materials and publications are available online. So people can always find our information on our website. If we have a meeting coming up, the agendas are there, all of the materials are there. And we aim to just keep everything as accessible as possible to the public. So the IACC talks about a lot of different topics that are relevant to the autism community, and some of the examples of topics we've covered in the last few years include racial equity and disparities, justice issues related to especially people that go through elopement, mental health, disability benefits, disability housing, diverse communication needs across the spectrum, employment supports, autism in older adulthood, supportive services, community engaged research, and family caregiving. And I've provided all the links here to the different meetings, but if you go to our website and go to the tab for meetings, you can find all of our meetings there and the videos are available. So the key document that the IACC is responsible for creating is the IACC Strategic Plan. And this is a plan that covers autism research, services, and policy. The plan provides an outline of priorities and directions for autism-related efforts across many different federal agencies, as well as working with private organizations. And it's one of the many ways that the IACC actually provides its advice to the Secretary of Health and Human Services. You can find our latest IACC strategic plan, the 2021 to 2023 plan, on our website, as well as an easy read summary. So the 2021 to 2023 IACC strategic plan represents a collective voice of the IACC. The process that's used to create each of these strategic plans involves a lot of gathering of community input through requests for information, listening to public comments, listening to the opinions of members of the IACC, as well as gathering information from federal agencies about their current activities. And all of this information coming in contributes to the IACC strategic plan, informed by many different stakeholders. The content of the IACC strategic plan has been focused around a framework of 7 question areas for the last many years. And recently, we've also added a few new areas. So the areas that are covered in the strategic plan include screening and diagnosis, interventions, the biology of autism, services and supports, infrastructure, research infrastructure in particular, and prevalence, genetic and environmental factors, and lifespan. And so these 7 areas have been the core of the IACC strategic plan for many years. And you might notice that they sound sort of like research topics. The initial IACC strategic plan that was released in 2009 was responsive to the law at that time that called for a research strategic plan. And in 2014, Congress expanded the scope of the strategic plan to cover supports and services more thoroughly. And the IACC decided to keep the same framework so that we could continue tracking projects according to this framework. But each of these questions also encompasses different services and policy issues as well. So in the latest strategic plan, there are some cross-cutting recommendations. So there is an expanded recommendation around sex and gender. And there's a new recommendation around promoting equity and reducing disparities, which it's not a new topic for the IACC in general. It was always woven throughout the different questions, but now it's been pulled out into a focused topic, but it is cross-cutting as is sex and gender, and those two cut across all 7 question areas. In addition, there's a section on the impacts of COVID-19 on the community. And the IACC aims to continue learning from that experience so that we can be prepared for the next time that there might be an emergency. So some of the topics that are covered in the IACC strategic plan include topics related to scientific research on autism and its co-occurring conditions. There's also information about services and supports, including home and community-based services, how to access services, healthcare, caregiver supports, the services workforce, and diversity of support needs across the community. There's also a section that's covering lifespan issues, and so these are some of the issues that impact people as they transition into adulthood and go throughout the adult period in their lives, including employment, education, housing, justice and law enforcement, the transition period itself, financial planning, social determinants of health, and aging and older adulthood. And there's also a focus on community integration and acceptance. And the IACC aimed to highlight the importance of reducing disparities and discrimination, reducing stigma, recognizing strengths and developing strengths-based approaches, the intersection of autism with race, gender, and other intersectional identities, increasing inclusion and accessibility, and also looking at neurodiversity and the importance of that and its impact on all of this work. So the updated priorities in the 2021 to 2023 IACC strategic plan, this is sort of a summary of some of the top new areas that were covered in the strategic plan, include promoting greater acceptance and inclusion of autistic individuals, increased accessibility of services and research for autistic individuals and their families, solutions for people that cover the whole spectrum, including those with the very highest support needs, solutions that cover the whole lifespan, going all the way into older adulthood, solutions to improve both physical and mental health for autistic individuals, the intersection of social determinants of health and the services system, and increasing equity and reducing disparities. So I'll also share with you that we have a forthcoming 2024 IACC strategic plan update coming up, and this is going to be focusing on co-occurring health conditions. And this is a topic the IACC has been interested in for quite a while, for many, many years. And early on, when this issue came up in the committee, back in about 2009 or so, this topic was somewhat controversial. People weren't really sure what the role of co-occurring health conditions was in the well-being of people on the autism spectrum. Are these really common or are they not? And in the ensuing time since the IACC first started making its recommendations to support more research on co-occurring health conditions, now there's quite a robust portfolio of research, and we all know, we've seen in the literature many publications that confirm that co-occurring health conditions do play an important role in the health and well-being of individuals on the autism spectrum. And so this report is going to dive a little more deeply into this, trying to summarize what we know about some of the most common conditions and also some of the conditions that we don't even know what the prevalence may be, but we might hear anecdotally that many people on the autism spectrum experience some of these conditions. So we're going to be covering physical health conditions, including issues such as epilepsy, GI issues, sleep disorders, sensory motor challenges, Ehlers-Danlos syndrome, and some other different issues. We're also going to be covering mental health and behavioral health, and there are many different mental health conditions that occur in individuals on the autism spectrum that will be covered, including anxiety, ADHD, self-injurious behavior, suicidality. So some of these issues will be covered in this report. We're also going to look at other kinds of co-occurring conditions, including intellectual disability, there's a community discussion around individuals with high support needs in the draft as well, communication challenges, related developmental disabilities, and learning disabilities. And there's a section in the report that's going to talk about healthcare service provision and how we can improve healthcare provision to benefit individuals on the autism spectrum and address issues that of accessibility in the healthcare setting. So this report, to prepare it, we collected quite a lot of information from the public through a request for information that the IACC put out, and they received over 1,200 responses that were all analyzed and coded to help us make sure that we're covering all the appropriate issues. And the committee approved the draft in September 2024, and our office is working on getting it fully compiled and ready for publication. So be expecting to see that report soon, and we hope it will be informative and helpful for ongoing efforts. So some different reports that the IACC has put out in the last few years include our strategic plan, which is the one in green that is to the farthest left. Also 3 issues of the Summary of Advances in Autism Research. And there's also another report called the Portfolio Analysis Report that our office puts together, where we collect information from all of the federal agencies in the US, as well as the major private funders of autism research. And we take all of the different projects and line them up with the priorities described in the IACC strategic plan to try to determine how much research is going on in each of these categories. Are there areas that may have gaps, or are there new opportunities or things emerging? And we describe this in a lot of detail in these reports. And so the latest report that's out right now is the 2020 report, and we're working on the 2021 for release soon. And the reason there is a little bit of a lag in that is that we have to wait for that fiscal year to close and then collect all the data, analyze all the data, and work on the publication. So it takes a while after the actual year has closed before we can publish the information. But we look forward to publishing that, and all of the data that we collect, we also make available to the public in a database that's on our website called the Autism Research Database. And you can always search that database for particular topics of interest, and it might be helpful in identifying collaborators or people that may be authoring papers that you're interested in. So check out that website as well. So on this slide, we have the web link or the URL for publications, but the ARD, the Autism Research Database, is available from our homepage. So that I described our domestic portfolio analysis report. We also historically, in 2016, we did an international portfolio analysis report, and I thought I would share this here since this is the World Autism Summit. So in that 2016 report, we collaborated with the UK, Canada, and Australia to produce an international report, and we were able to collect information on funded projects across those countries and compare the portfolios in terms of the different areas of focus and the different types of projects being pursued. And it was a very interesting analysis. We hope that we are planning to do another report in the next couple of years, and we hope that we will be able to get many more countries to engage and be involved in this, because we'd like to cover more of the globe, including, you know, high, middle, and low income countries, so that we can be, you know, include a wider variety of different autism research projects happening around the world. So stay tuned for that, and if you happen to be somebody that's involved in funding autism research and you want to participate in our upcoming international portfolio analysis, or if you're a US funder and you're not in our portfolio analysis now and you want to be, please reach out. We'd love to talk about getting you involved. So, and this is just a slide to basically say what I just said, which is we're going to be doing a future portfolio analysis report that's global, and we welcome collaboration. So next, I'm going to turn some attention to my role as National Autism Coordinator. So the Autism Cares Act of 2014 and continuing into the Autism Cares Act of 2019 requires that the U.S. HHS Secretary, Secretary of the Department of Health and Human Services, designate a National Autism Coordinator to oversee, in consultation with the Secretaries of Defense and Education, national autism research, services, and support activities. And from my earlier slide where you saw those insignias of so many different federal agencies and departments that are involved, you can see the reason that there might need to be somebody that has a vision to see all of the different things going on and to help coordinate efforts. And the National Autism Coordinator is also charged with ensuring implementation of the IACC strategic plan and preventing unnecessary duplication of effort across the agencies. So the responsibilities of the National Autism Coordinator are to oversee national autism research, services, and support activities. The NAC also convenes the Federal Interagency Work Group on Autism, which is an all-federal working group. And this is the arms and legs of this effort and how we get things done in terms of the coordination behind the scenes. The IACC, or the National Autism Coordinator, also coordinates implementation of the IACC strategic plan and coordinates interdepartmental efforts and requests, including reports to Congress and other kinds of requests that come through that the federal agencies need to respond to. Also, we take an active role in monitoring other federal advisory committees across our government. We have many different federal advisory committees that cover issues, especially issues related to disabilities, that we also keep track of so that we're not duplicating effort and we can take what we're learning in the IACC and be informing other disability-related committees or other types of related committees, maybe health or other types of committees, to make sure that they're covering issues related to autism and that we're also bringing back information from those other committees to the IACC. We also facilitate exchange of information, connections, and collaborations across federal agencies and ensure that there's no duplication of effort across the agencies. So the Federal Interagency Work Group on Autism, as I said, it's an all-federal work group, and we foster collaboration across all the agencies, and we work together on joint projects, including reports to Congress and other responses to inquiries that impact the entire federal effort on autism. And currently we have 24 federal departments and agencies that are a part of this body called the FEWA. So, and I'm the chair of the FEWA. So with the federal agency implementation of the strategic plan that the NAC, the National Autism Coordinator, is charged with, we have this plan that identifies multiple areas where federal activities can address ongoing needs and benefit the autism community. And the IACC is serving in that role to provide a forum for discussion and community input and then creating the plan. And then the next layer is for the National Autism Coordinator to work through the FEWA to provide coordination of federal agency efforts to implement the plan. And many different agencies and departments are actively working on various parts of implementation. And this is just a few of the different reports to Congress that we've put out in recent years. So in 2021, there was a report to Congress on the health and well-being of individuals on the autism spectrum that was by request of Congress. In 2022, there was a report on supportive services for individuals with autism that was also by special request. And we also, every few years, do a report to Congress that covers all federal activities related to autism and other developmental disabilities. And this report was most recently released, covering 2019 to 2023. And those are also available on our publications page. So federal agencies, including those that are represented on the FEWA, contribute to many of the autism research, services, and policy priorities identified by the IACC in the strategic plan, including those related to K-12 education and post-secondary education, those goals related to education for healthcare providers on intellectual and developmental disabilities and expansion of the public health workforce, research on autism and co-occurring health conditions and evidence-based interventions to improve health and well-being, support for national resource centers, state programs, and other initiatives that improve mental health outcomes, legal support and enforcement of anti-discrimination laws in K-12 schools and institutions of higher learning, initiatives, resources, and services to foster full access to employment opportunities, including competitive and integrated employment, and programs that support independent living, including home and community-based services. And this is just, you know, a snippet of some of the different areas that are covered. There are many others. Our office has also been involved in international activities related to autism, representing the US effort. And we've had the opportunity to collaborate with international leaders to increase awareness and acceptance of autism and to promote the health and well-being of autistic people around the world. And some of the recent activities that I've had the privilege to be involved in include the April 2024 Canadian Autism Leadership Summit, and I've been really pleased to see how Canada has been working on their national strategy, and I'm excited to see that they now have released their national strategy and will be moving forward on their plans around autism. There also was in April an IACC meeting where we focused on global autism activities, and we had many international speakers share some of their activities on autism research, services, and policy. In June 2024, at the United Nations in New York, there was the Conference of States Parties to the Convention on the Rights of Persons with Disabilities, and there were 3 side events on autism, which was really wonderful to see. And it was just great to see that autism was being raised to that level of visibility within this very important conference, including 160 different countries. And just a couple of weeks ago, or actually last week, in October 2024, the World Health Organization's Mental Health Forum had a session that I co-led with James Cusack of Autistica in the UK, covering neurodiversity and the potential opportunities for neurodiversity to inform the work of the WHO worldwide on autism. So again, with the national strategies that have been emerging around the world, there are some common themes that I wanted to point out to you that include inclusion and co-design with autistic individuals and people with lived experience, cross-sectoral collaboration, crossing all of these different agencies or ministries across different governments, including health, education, social services, labor, housing, and others. The importance of awareness, acceptance, and reduction of stigma, and the importance to uphold equity and human rights. So that is most of my presentation. I want to encourage you to connect with us at the Office of National Autism Coordination and the IACC. We have a website with lots of information. We post updates from federal agencies in the US that are doing different kinds of autism and disability related work every week, and that's always updated. We also have all of our publications available on the website, the Autism Research Database that I mentioned, and materials related to our publications. Our office also holds events from time to time, and in April we usually have a special event. And we had a special event last April, and we will be doing one in 2025. And we host other events as well, so we always put that information on our website. Feel free to join our mailing list. We send out updates via email, and you can connect with us on Twitter or reach out to us by email. And if you've listened to this presentation and you live in the US and are a US citizen and you are interested in serving on the IACC as a public member, stay tuned, because as soon as Congress passes the next Autism Cares Act, we will be putting out a call for nominations for people to serve on the IACC. And I'd just like to thank my wonderful team at the Office of National Autism Coordinator for all their support and their passion for working toward the health and well-being of all autistic people and people on the neurodiversity spectrum. Thank you so much. And I will go back to the Gatherly platform. I'm going to stop sharing that. And if anyone has questions, feel free to pop them in the chat, or if you want to come on stage and ask orally, you can do that too. So I'm available to answer questions if anyone has any. So there's a question here. I'm an autism mom to an 11-year-old. Are there any resources for therapies available for kids for single moms? I don't know of any therapies that are specifically targeted to people that are single moms, but there are a lot of, are resources related to therapies in a lot of different places. I don't know where exactly you're located, but there is information available from a lot of different advocacy organizations on the National Institutes of Health websites. Social skills therapies for kids in Houston. Yeah, so there is quite a lot of information available publicly about different types of therapies, and Stephen Shore this morning covered some nice information about different therapeutic modalities. So if you have additional questions, maybe you want to write to us and ask more specifically. Any programs that can come to schools to talk about autism and kindness? There aren't any specific programs out of the federal government that focus on that, but if we receive requests to come and do presentations, you know, whether it's our office or perhaps if it's something that's more appropriate for another federal agency, we would pass along the request and make sure that somebody receives that request. But we do give presentations for different groups from time to time as people request them. So I have a question about, so what drew me into this work? So I trained as a neuroscientist, and while I was in graduate school, I just, I enjoyed basic research. I was working on neuronal development and in a model organism, and I am a biologist. I'm someone who loves nature. I love biology, and I enjoyed that research, but I really kind of felt like something was missing. I wanted to do something that was beyond the lab, just for my personality type. And I stumbled upon a couple of really important individuals who told me about what it was like to work at the nexus of science and policy, working in Washington. And when I heard about that, something just kind of lit up. I really thought that sounded exciting. So once I finished my PhD, I came to Washington, worked at the National Academy of Sciences for about a year, and then I came to the National Institutes of Health, and I've been there ever since. I worked initially on Parkinson's and Alzheimer's, which was a great experience, and I think what I liked most about that was working with advocacy organizations. I just really enjoyed hearing people with lived experience talk about how our work could be more impactful and how impactful our efforts were for them. And I just love that kind of connection. I spent a few years working in infectious diseases just because there were some policy opportunities there. I really enjoyed the skill building that I did there, and some amazing people as well. But then about 16 years ago, an opportunity opened for a leadership position in autism, and that sounded like just a dream job to me. And so I came to NIMH, and I've been here ever since, and I've had some shifts in my title, but I've essentially been doing similar work, helping lead policy efforts and research-related policy for autism. So that's what brought me here, and what keeps me here really is the community. I really enjoy working with the community, hearing people's stories. trying to solve problems, figure out new solutions, and to try to help foster innovation. So that's what keeps me going. And I know this is an ever-changing field, and it's a complex field, but I also like complexity. I think it makes the world a more interesting place. So I know my team shares our passion. We all really want to make a difference for people on the autism spectrum. We're not here just to collect a paycheck or, just be here in a job. It's something that really means a lot to us to try to connect with the community and make a difference. So there's a question about the waiting list in Texas is very long. My main concern is housing for adults with autism and intellectual disability. Hope this will be different for Texas in the future. Thanks for all you do. Yes, housing and waiting lists are really important issues. I know that my colleagues in the Department of Housing and Urban Development and the Administration for Community Living have been really working hard on expanding opportunities for disability housing, but there's more work to be done, and we're all working on that issue as well as the waiting list issue. So thank you so much. Any thoughts on the suggestion that neurodivergence gives an evolutionary advantage to our species and may have been present for as long as there have been humans? Always wanted to ask a biologist that question. And we don't know a definitive answer since we haven't really been measuring all of that for all that long, but it does seem that neurodivergence has been around for a while, and we all know that there are benefits, there are strengths to neurodivergence, and so yes, I think that there are some advantages. I mean, people also have challenges. And I think some of the work that we're doing in various organizations and governments are trying to address challenges, but we also need to recognize all the strengths. And I see from Adriana, thank you. Well, thank you for being here. I really appreciate you listening and hope that some of the information I've shared has been helpful. All right, well, it seems like I think I've answered the questions that I received. So I think that I'm ready to end my session unless there's anything else that's needed. But thank you again for attending. I really appreciate it. And enjoy the rest of this amazing summit.